Hello, everyone. My name is Tatiana Giddings, and welcome to our COVID-19 edition. According to the Center for Disease Control, CDC, the coronavirus has been in the United States since January of this year. The virus has devastated many in the United States, especially students. Many institutes of learning worry about contagion. With us today to discuss the concerns and many more is the Dean of Students and Vice President of Student Affairs, Dr. Dennis Hall. Thank you, Dr. Hall, for being with us today.
My pleasure. It's nice to be here.
Let's begin. With this fall semester, what has been the biggest challenge of the semester as far as planning for the coronavirus spread?
I think the biggest challenge overall is the number of variables that are completely outside of control of the faculty, staff, and students, right? I think that there's so many things that we're subject to that we cannot effectively regulate or control. And that's really challenging, right? Because our education is our mission. That's why we're here. Students' academics and their success through their time in college, and their health and safety has to be prioritized in order for that mission, for that goal to be realized, right? And so when you're trying to respond to a pandemic to make sure that students' health and safety are maintained, but you can't control all the different factors, that becomes very, very challenging.
So walk us through again, what are some of the strategies Wesleyan put in place?
I think one of the, there are a lot. So one of the big ones has been the delivery of courses of instruction, right? The teaching and learning going into a hybrid format was a big step in trying to mitigate any sort of impact from COVID-19. The primary reason is that it decreases the density of people on campus at any one time. We recognized the importance of a face-to-face interaction, and the faculty, because it was a faculty decision, really moved forward in providing, I think, one of the most dynamic and adaptive structures possible for our students. So, the hybrid model was really important. The ability for students to complete all course requirements virtually, offering a face-to-face but not requiring the face-to-face, allowed students to pick the best course of action depending on what's going on in their lives. Right? We recognize that while the university function in life is very important, obviously, to myself as an administrator, but it's not the only thing that's going on in everyone's lives, right? Many of our students are parents. They might have children who aren't able to go to their normal K through 12 school experience, and so they've got to be able to juggle a lot of different responsibilities. So that was a really great thing that I think the institution did. A lot of it also rests with the Return to Campus guidebook that the Rams Return Task Force created, where we set out policies and expectations. We put up different flyers and materials on campus explaining, all right, this entrance is an exit only, this entrance is or this door is for entrances, but reminding people about wearing a mask, being socially distant. A lot of effort went in to do that as well.
Right.
I would be remiss. One of the other things that we did, and I imagine this might be on your list of questions for me, is we reduced the occupancy of our residence halls. We for the 3 halls, Stella, Elizabeth, and OC, that had double rooms, so shared by 2 people. We switched all of those to single occupancy rooms, and I think that played a healthy role in trying to reduce the spread of COVID among our students.
So in your opinion, how would you rate how Texas Wesleyan has managed the COVID compared to other universities?
I think that I'm very proud of all the steps that we took. I think that we looked to do a lot of proactive things and try to make decisions on the front end as much as we could, and to anticipate. And again, it goes back to anticipating is tough when you can't control all the variables. So you have to do your best. I'm very proud of the work that we did. I think one of the things that set us apart from a lot of institutions is our sheer size, right? our tagline of being smaller, smarter, I think it really played into our favor for this last 8 months, because we were able to offer face-to-face classes while people could be socially distant. But if you have a class, and I went to a large public institution as my undergrad, and I can remember being in a class with 400 other students. There is no way
Mm.
that they're going to have, unless they're using a football stadium, or a basketball stadium, there's no way that they're going to be able to provide a face-to-face opportunity and enforce social distancing when you have 400 people in a classroom, right? So I think that just our sheer size really helped us out during this pandemic, um, to continue to allow for that face-to-face interaction, which our students have told us time and time again has been very important to them, and something very valuable to the Texas Wesleyan educational experience, right? With that face-to-face, you get to know each other. There's relationship building that happens very naturally.
Right.
So we were able to really maintain an element of that, where some of the schools around us, for no fault of their own, other than they're a lot bigger, and that's tough.
Yes. So, have you received any complaints from students or staff regarding COVID-19 management?
I, I wouldn't say complaints. I think that one of the things that we tried to do from the onset of this is engage in a pretty um, regular communication with people about the steps that we're taking, the directions that we want to go, if there's a change in those directions that we need to take, and so there were ongoing feedback loops, right? And I think that happened with regularity, but I wouldn't describe those as complaints. I've been very proud of our students' responses during this time. I hope you all recognize the work and the sacrifice that our students put into keeping our campus relatively safe and healthy this fall semester. And I thank each and every one of you, because it takes a village, right? It has taken
Mhm.
all of us being committed to that to do it well.
Right. Well, with management strategies put in place, what worked and what did not work?
Yeah, so I think that's a good question. What worked, what didn't work? Again, I think the hybrid teaching and learning model, I think, worked for a lot of people. I think that at the same time, some of the feedback that I've heard is it was very challenging for a lot of people on the faculty side as well as on the student side of um, the engagement piece. I think was challenging in that hybrid format. And so, we'll continue. We're all in a learning curve of how to do this the best that we can, students and faculty alike. And so, um, I think we'll get better and better at it. We'll get another opportunity in the spring semester to continue getting better at that as we go into the spring with a hybrid model still in place. um, I think what worked, I think it was good for us to change the occupancy of the residence halls. I think that has helped us. You can't prove a negative, so I can't say what it would have been like had we not changed it, but I do think that we're fortunate when you look at our the numbers that we have published. I think that we've done a pretty good job as an institution. Um, I think that I don't think that the student screen tool was used as often as we thought it was going to. But that's okay. It's still a tool there that is able to be accessed, right? If an office were to request a student to screen before they come into a meeting, an in-person meeting, that kind of thing, it's still a tool that is there. But I don't think that it was being used by all students every day that they were coming to
Right.
campus. Yeah, good question. That's all I can think of right now.
So, okay, well, thank you. So, have you personally dealt with COVID-19, or do you know of someone who has?
You mean as far as like being diagnosed with it, or somebody in my family having been diagnosed with COVID-19?
Yes.
I have not personally,
Yes.
yeah, thankfully. Um, I have colleagues and friends who have had their friends or their family members who have been diagnosed with COVID. Thankfully, every example of that I can think of, they were not really severe cases. There were no hospitalizations that I was aware of, and people were able to um, isolate for that necessary amount of time, and they've come out and they've been doing well health-wise since.
Mhm. Well, that's a good thing that it didn't get severe. Well, we'll be right back after the break.
Hey, I'm Mike Rope, here today to encourage you to connect with 811 before you dig.
And I'm Micro, and I'm here because I love to dig in the dirt.
It's true. He's also here because he's very small and not that bright. Here, for instance, we can see Micro doing what he loves to do. And here we can see the consequences of not doing what he should have done. Dude, why didn't you call 811?
I forgot the number.
See? Not that bright.
Welcome back. Let's talk about student halls of living, our dorms. So, Dr. Hall, you were among the task force charged with strategizing for student return to campus in the summer and safety on campus, yes?
That is correct, yes.
Can you describe the safety precautions in the dorms?
Yeah, absolutely. So one of the big steps that we took was decreasing the occupancy, right? So as I mentioned a few minutes ago, in Elizabeth, Stella, and OC halls, the rooms are double rooms, right? Two people are sharing a room. We changed those to singles across the board. I think that was a good move. We also, to help not encourage social gatherings, we did close some of our common spaces, simply because it's tough, right? How do you socially distance while playing pool? That's going to be a really tough proposition. And so we did take the measures necessary to try to decrease any chance um, of violating that social distance requirement. Um, we had the mask. Maybe I need to start over. We had the mask requirement that we enforced in the residence halls. We also had to create a policy to say no visitors, right? Um, we really wanted the residence halls to be a safe place where spread wouldn't get the opportunity to happen. Um, so yeah, those are the big ones.
So was the no visitor rule, was that difficult to follow through?
I think that yeah, I think it was a very difficult rule to put in. It's such a departure from what we're used to, right? Our
Right.
normal, for the last few years that I've been at Wesleyan, we've been working very hard to try to create community, which involves that interpersonal interaction. It involves the relationship and going and doing things together. And then, you've got this big like stop down of all of that this year because of COVID. So I do think that it it went against the grain of who we are, um, as student affairs practitioners, of people who work in housing, right? As an industry, we are
Right.
community developers, and this year we had to say, let's do it in a virtual format only. It's contrary to what we were trained to do. So that makes it
Right.
tough. And I think it's probably tough for our students too, right? Like, many of our students are social
Yes.
beings. They want to be around their friends. They want to be around um, their their boyfriends or girlfriends, and we had to enforce a policy that said, please don't. Right? Our expectation is that you don't, and that's tough.
Yeah. So do you think the safety precautions in the dorms are right to avoid an outbreak?
I think they are. Yes, I do. I think that we've done a lot of good work. I think that I'm trying to think if there are any other policies or expectations that we could have changed to make it better. And I think that we did a lot of good work. And again, I go back to it. Our students abiding by the policies really is what has made a really big difference. I think many of our students understood why we were taking it so seriously, and because they chose to uphold that and they were holding each other accountable. I think that I look back on the fall semester and I think it was a very successful semester.
That's good. So far in the semester, what is your evaluation of those dorm safety precautions? Like on a scale of 1 to 10, on 1 being very poor and 10 being excellent.
You know, that's really tough because I don't know what I think the metric of what would be considered excellent is tough, right? I think
Right,
it's easy to say, well, excellent would be if we had 0 cases, but that's also not realistic
right,
because you can't you can't look to the residence halls and say, oh, it's because they were living on campus that somebody ended up being diagnosed with COVID-19 either. Um, yeah, so I would say we're probably around a 6 or 7. I'm sure that there are things that we could do better, but I'm very proud of the work that we did, and we had a lot of people pulling on that rope together to make it successful.
right. So we heard from international students not being able to return home, and they complained about not being able to pay the cost of the dorms for the winter break. So what do you think of their complaints? Would the dorms be open, or would they need to stay? What would they need to do to stay?
Well, I would say if there are any students out there who um, because of the additional costs of wanting to stay over winter break, and a winter break that is almost twice as long as it has been in years prior because we adjusted the fall contracts to end this Saturday as opposed to mid-December, right? um, since instruction is going completely virtual after Thanksgiving, the halls are technically closing this Saturday, right, as opposed to mid-December. So our winter break is a much longer time period. But if there's any student who really wants to stay, but the price of that or the cost of that is prohibitive, I would encourage them, reach out to me. Let me see if I can work with you one-on-one to find a good solution. Um, uh, yeah, that's what I would say.
So
And
what?
I understand being able to go home. You don't know if you're an international student. You don't know if you're going to be able to come back in time for the spring semester. There's a lot of turmoil. I'm sure there's a lot of stress that goes into making those kinds of decisions, and we want to help you find an appropriate answer if you're an individual in that situation.
So if people choose to stay on campus during the break, what measures have Wesleyan taken to make those living situations better?
So we're going to try to be providing some sort of, because our dining services is going to be closed over winter break. Um, and we all know there's not a ton of food options in the area,
Right.
within walking distance or whatever that might be. So the Housing and Res Life team is working with some folks, including SGA, the local food, our Texas Wesleyan Food Pantry, to come up with some like meal kits for people who we know are going to be here.
Okay.
But we are enforcing the same COVID policies through winter break that we did all fall semester uh, with regards to the residence halls.
Okay. So the campus has 7 or more different entrances. So what changes were made to prevent visitors from entering campus and possibly spreading the virus?
Yeah, so that's tough, right? So there was a lot of conversation around that of how do we regulate. It's easy to identify who's an employee of the university, who's a student of the university, and come up
Right.
with policies and expectations. Visitors are tough. So if you look from our admission standpoint, they went to virtual tours so that the visitors coming on because they're interested in joining as a student, they wouldn't have to physically come to campus, right?
Right.
All of our orientations have been virtual since March. Um, for that same purpose. We're trying to keep the density of people on campus as low as possible. The visitors is in the form of like vendors, right? People who
Right.
we have come to campus to do work on our campus or to um, take care of whatever business we're hiring them to do. They're the point person who's hiring them. We developed a screening process for each of those visitors as well, where they would have to go on and report whether or not they had been exposed to somebody with COVID-19, if they had any symptoms. And frankly, it's the responsibility of the employee who is engaging with that vendor. If they failed that screen, they're not allowed to be there that day, right? Until the time has
Mhm.
passed enough to where they would not present um, a threat to our campus community. In addition, all visitors were expected to abide by the same social distancing expectations and face mask expectations.
So how effective was it getting the vendors to follow the screenings?
I think by and large, the feedback that I've heard is that it was fine, right? Because most of the vendors that we have who are coming on campus, those visitors, there's a relationship with somebody. They're there because of some sort of connection to an employee, and so um, my understanding, I have not heard any complaints come my way of how that was enforced.
Concerning what did not work from the initial established strategies from the summer, what changes have been made?
So I will say that some of the changes that were made are more on the backside of the communication and tracking of COVID cases. So, for example, one of the things that we've said from the start of all of this is that we were going to follow the guidance of health professionals and the CDC, right? And we have continued to do that, but the guidance coming out of the CDC has changed over time. It's evolved as we've learned more about COVID-19, as the CDC has learned more about COVID-19, some of their guidelines have changed, right? And they've been able to conduct a lot of research that then informs the kind of suggestions and guidance that they're giving us. So one example is if you are, we had a whole flow chart of if you're diagnosed with COVID-19, this is what you would need to do in order to return to campus safely. Well, and that was based off of what the CDC was saying at the time. But in late October, the CDC changed, and so and their guidance changed to saying, okay, after 10 days from when symptoms first started, if you got tested and were symptomatic with COVID-19, 10 days after the first symptom started, you could be eligible to resume in-person activity if you have no fever for 24 hours. Um, and you're not using fever reducing medications, right? Like Tylenol or ibuprofen or and any other symptom that you might have related to COVID-19 is getting better. Well, at the start, it was you've got to have 2 tests showing that you were negative for COVID-19. Those tests had to be at least 24 hours apart, right? And so as the CDC guidance changed, so did ours, and that's we tried to evolve along with um, um, those guidelines, those suggestions coming out of from the experts.
We will take a short break. Stay tuned.
Can't work for COVID-19 reasons like a stay-at-home order, quarantined, seeking diagnosis for symptoms, caring for your children because their school or care provider is closed, or if you're caring for someone under quarantine. You may be eligible to take up to 2 weeks of paid sick leave and additional leave for childcare needs. Visit dol.gov/FFCRA or call 866-4-US-WAGE. A message from the U.S. Department of Labor.
Welcome back. I would like to focus on facilities and next semester's plans. Have there been any changes in the maintenance of campus facilities thus far, especially the ventilation system in dorms and classrooms?
So I know that I would definitely defer to Brian Franks to give a more expert answer on this because I cannot speak with as much certainty about everything that has happened on a facility standpoint, but I know that they have increased pretty significantly the amount of regular cleanings of all of our spaces that are being used and sanitizing of those spaces. The ventilation systems, again, I know that has been a topic of conversation. I wouldn't want you quoting me on exactly what they've been doing, but Brian Franks should be able to more clearly articulate those things.
Okay. It's almost Thanksgiving break, and students are expected to finish the semester virtually after Thanksgiving, which is great, especially with the continuous spike in coronavirus, especially in Tarrant County. Is that light? What are the university's plans for the next semester to prevent COVID-19 spread?
So we have announced that we are the spring semester is also going to be a hybrid delivery of instruction and learning. Um, one of the big things that is going to look different is spring break. We are going to keep the traditional spring break. However, the week after spring break is going to be a virtual only. and that is to give time for people to come back. And um, if people do travel, and who knows what kind of spread we're going to see in March of 21. Hopefully we're getting close to hopefully we're getting better at that point. Um, but we're going to be continuing with the same set of expectations that we have had for this fall, moving into the spring semester.
Okay. So how would the returning process be different for international students, especially those who might travel back to their home countries for the winter break?
It's really going to be the same. We are going to rely on, um, if you're symptomatic, you need to let us know. You need to quarantine. But we're not going to.
Right.
As far as the conversations that I've been part of, we're not going to have a mandated quarantine for anybody who has traveled. There's not really a safe place to travel from, right? At this point, the United States is a pretty hot spot if you look
Right.
worldwide. And so um, uh, the real thing is just about keeping our community safe by recognizing if you are symptomatic, you need to isolate and quarantine.
Okay. What is the new rule for class attendance? Will students still have the option for face-to-face or virtual classes next semester?
Yeah, so it will be a hybrid approach similar to the fall, where face-to-face options are going to be available for students as well as a virtual. However, if students want to complete it virtually, they can do so. The big difference is this semester, our faculty were allowing for asynchronous completion of all course requirements. Next semester, that is going to be that's going to require each individual professor's approval for a student in a class to go in an asynchronous time frame.
Okay. This year, the school has made the decision to cancel graduation. Any plans for the May 2021 graduation?
No, and I would say we haven't canceled graduation. We've just postponed it until a time which we can execute a graduation that would satisfy what people want from such a celebratory experience. And so right now we're very hopeful. We're optimistic that in May we will be able to have a traditional commencement ceremony. But I do think that it's just too far out to say with certainty one way or the other that could go.
Right. So let's go a little bit political. How do you think a presidential change in 2021 will impact higher education as far as COVID-19 strategies?
For us, it probably won't have a tremendous impact. We're going to continue to follow the guidance from the CDC and the health professionals that we have hired as consultants, or not hired, but that we've engaged with a consulting relationship with to continue to provide those services for us. And so while things may be changing in the federal government, um, our course of action is going to be guided by the same things.
The Pfizer and Moderna vaccines seem to bring much hope. Texas Wesleyan has always been involved with social issues, such as being a space for early voting. Do you think our campus will be involved in the distribution of the vaccine if the opportunity arises?
Yeah, I think if the opportunity arises, if we have a chance to help serve our campus community by providing those vaccines, absolutely. I think that we would pursue that. Similar to flu shots, when we can provide that, we want to be able to do what we can to make it easy for our staff and faculty and students, right? To be able to have access to those things. Um, y- I think there's just a lot that we don't know, that I don't know personally, as far as what's going to be the cost of the vaccines. Do students or will individuals need to have health insurance? But if we can be set up as a place where people can come and receive those vaccines, whether it's administered by anybody here or it's an off-campus entity who comes to campus, I think that would be a great opportunity to bring a service and a resource really close to and to be there for our campus community.
So Dr. Hall, is there anything you would like to share with us about the coronavirus as we wrap it up here?
I would just I would just ask everybody, please make sure that you are taking care of yourselves. You are taking care of each other, right? The holiday season is coming up, and what we have seen in the last 8 months is after every holiday, whether it was 4th of July, Halloween, Labor Day, right? There's a corresponding spike of cases, and right now the caseload across the country is bad. I think it was on Wednesday morning. I think there were 32 beds left in ICU across Tarrant County. That's one of the dangerous things about this pandemic is, and at the start of it, a lot of talk about flatten the curve, right? Because you don't want these large spikes, because then our hospitals and our healthcare systems can't manage that influx of people needing such immediate care. And so please make sure that you are taking care of each other. I know it's a lot to ask, but if you can hold off on those large gatherings around the holidays, that's going to help. And I think that we need to stay committed to keeping our community safe. And a lot of times that requires a lot of sacrifice on the individual part. But I would just ask all of you, make good decisions, be well, take care of yourselves, and take care of each other.
Well, on a lighter note, I can't help but ask you, what are your plans for Thanksgiving?
We are staying home. So we, typically every year we open our doors to any member of my staff who doesn't have a place to go for Thanksgiving, or if they're not going anywhere for Thanksgiving, they can come to our house and join us in our family Thanksgiving. But this year, unfortunately, because of COVID, we are saying that it's just going to be the 3 of us and our 2 dogs staying at home.
Well, thank you, Dr. Hall. Thank you so much for joining us today. This
My
has been
pleasure.
quite informative. This has been quite informative. It is nice to discuss with you about the students' safety. Thank you, everyone, for tuning in to this special edition. Do not forget to follow us on Facebook at The Rambler and Twitter and Instagram at The Rambler TWU. My name is Tatiana Giddings, and this is Rambler TV.
Rambler TV.